Just want to also remind everyone that for these training sessions, we're using a specific training environment. So the training environment uses de-identified data from a subset of time, so it is not up to date, it is not fully accurate, it's just really to give a view of what the tool is going to look like. There's also going to be some features that may change a little bit once you get into the live tool as we finish ironing out all the final details for the live tool. However, for the most part, this is going to be a good representation of what you will see once you get access to the live tool. All right, and just another reminder that a bit earlier this year, the CCT administrator email was updated to tencare.cct@tn.gov. So please make sure you add it to your safe list so it's not sending all emails from that address to your spam or being blocked by the firewall. We are sending a lot of updates on training, when the tool will go live, what to expect, how to sign up and request access to the tool. So please make sure you're reading those emails as they can be very informative. Okay, so for today's agenda, like I said, we're going to be focusing on quality measures. And this is really looking at understanding your specific organization's overall quality measure performance, reviewing a specific quality measure, and understanding an individual member's gaps in care and whether they're compliant or not. So with that, I am going to jump over to the tool. And again, I am logging in as a practice administrator for these demos. These are case-sensitive passwords, so definitely make sure you're typing it in correctly. All right, and as you're probably becoming more familiar, when practice administrators or care coordinators log into the tool, they're going to be landing on what is called the care dashboard. And the care dashboard is just going to provide a quick overview of a lot of different items for your practice. Earlier this week, we were focusing on members section, and today we're going to be focusing in on those quality measures. So we can see here on this widget that it's going to give you a quick overview of how many of your members have met their associated measures and those who have not. You can also see down here, there's a quick little graph of quality performance by domain. So it's broken out into respiratory conditions, utilization, cardiovascular conditions, prevention and screening, behavioral health, and diabetes care. So here we have our little guide that the green means met and the orange means not met. You can also get that hover over on top of the graph to see that for this respiratory condition specifically, we have over 428 individuals who have not quite met these measures. And the green, we have 247 who have met them. So this is just a quick overview of what you'll see on the dashboard. I am going to now click into the quality measures widget, and we're going to dive a bit deeper. So once you click on the quality measure widget, it is going to have a pop-up that's going to take you to 3D analytics specifically for the quality measures. So you'll just want to make sure that you have pop-ups enabled for your web browser, otherwise it will not pop up for you. Okay, so up here, you're going to have the first line of choosing the type of report you're going to want to run. So we have line of business. This is always going to be Medicaid since we are serving the TennCare population. The coverage type is going to be based on the type of program you are. So whether you're PCMH or THL, that's what will automatically populate. We do have one organization that is both, so you'd be able to toggle through either. For the health plan, this is going to pull up all of the health plans, and you can choose to run the measures by all organizations that you're contracted with, or just a single one of the health plans you're contracted with. So I'm just going to choose one for the sake of making sure the data loads quickly. For the practice, it is only going to load your specific practice. So you won't have any other organizations to be able to choose from. The practice type is based on the type of practice that you have been designated as, so it'll show the correct corresponding measures. So whether you're an adult, family, or pediatric, you can choose all as well. You do have the ability to choose time period, and I am going to focus on current year of 2020. Once we've chosen all of our specific report features, I am going to view report. All right, and we can see that it automatically will have all of the domains open with each measure, just to give you a quick overview. If this is a bit overwhelming and you're wanting to just focus on one or two, you can go up here and choose to collapse all rows. And then you just come back over to the domains and choose a specific one that you were wanting to focus on. If you did want to go back to a full view of all of the measures at the same time, you just come back over here and choose expand all rows. So when we come back over here, we're just going to focus on this first measure, the behavioral health. We can see that we can hover over this blue text and it'll give you the definition of what this measure is. We can see that it is giving you the number of individuals who have met the measure, those who have not met the measure, those who have been excluded or have an exception, what the denominator is, and then it'll give you an overview of the performance. So this orange is going to show you the practice's performance, and the red flag is the benchmark. The variance percentage is just showing you the variance of where the practice is in their performance trying to get to the benchmark. Over here we have the gaps to meet benchmarks, so how many members need to close their gaps in order for you to get closer to meeting the benchmark. And then the gaps closed by claims, so professional claims closure versus gaps that were closed manually within the CCT. So, and we will go over this a little bit, more as we go through this session. You will have the ability to manually close gaps. You may have remembered that from earlier in the week when we showed you how to do that at the member level. This is where it would show that it was closed manually. And here you see that these three have been closed specifically by claims. For the pay for performance level of detail, that all has to be closed at the claims level. So anything you enter manually in the CCT will not count towards that performance at the MCL level. So we can also drill down a bit more and see all of the members specifically related to met and not met. So we can click over here, this little plus icon, and it's going to open up and give us a bit more member level detail. So here you can see we have a few different tabs. I'm going to start with the first and we'll work our way over. So the first tab is going to show you all three of the members who have met or closed this gap. It's going to show you their member ID number, their last name, their first name, their gender, their age, enrollment status, phone number, address, any screening results or medication name, code description, the date that it was documented or the date of performance to close the measure, who the rendering provider was, the source, and then gaps closed manually. So we can see for these specific gaps, they were all based on pharmacy claims, and none of them were closed manually. We can also export this information. We have the ability to export to Excel. And this would just, if you choose this version, it's going to export to what you're currently looking at on the screen. So if you're just looking at this behavioral health measure, this is what would populate. There's the ability to also export all members to Excel. This is to get all of the measures for every single individual in your practice. So depending on how large your organization is, this could take a few minutes. This is not going to take a very long time, so it's not like you need to worry about running this after hours or anything. Just want to let you know, because it is a bigger load for those large organizations, it could take a few minutes. You can also export into CSV. You could export to PDF or to rich text format. Okay, before we do that, I'm going to go over a few more of these tabs. We have the Not Met tab. So you can see all the 123 individuals that have not quite met this measure yet. And it'll again list out all of the same information. This can be helpful to export if you're needing to do some outreach to individuals to help them close this measure. Again, you'd be able to go up here, and now I'm actually going to export to Excel so we can see what this will look like. And once you get it to Excel, you'll be able to do a bit more data manipulation for your care coordination purposes, whatever your clinic workflows are. All right, so once the export pops up, this is what it's going to look like. You can see, again, it is focused on just that one tab that we have been focusing on, the AMM measure, and those individuals who have not met this measure. So it gives all this detail, including their phone number and address for any outreach purposes that you need. And you can dig down and do any other data manipulation you need from this point. Okay, we also have those who have exclusions or exceptions. And again, this number will match what's up here. And then we have the denominator, so all your members who would be eligible for this measure. We can also dig down a little bit deeper once we get into these tabs. So if you're wanting to see, let's say, for example, those who had met a bit more specifics on how they had met this measure, we would click again, this little plus icon over here next to the member's ID number. And it's going to list all the different codes that helped close this gap. And again, we can see none of these were closed manually. These were all specifically closed by pharmacy claims. And we can see the date they were performed and the specific code. So let's say we want to get an idea of how we're doing as an organization performance-wise on all of the different measures. You just, again, go ahead and expand all rows. I'm going to go ahead and minimize this. And so we can see the performance for all of the different measures that this test organization is eligible for. And if we wanted to export that to Excel just to get that overview, we'd go ahead and export. This could also work as a PDF if you're just needing to take it to a meeting and look at strategies on how to work towards closing more measures. But we know a lot of individuals like working with the data manipulation in Excel, so we definitely wanted to make that available. So you can see here, it's just going to populate the same information that it was showing on the screen, you know, the met, not met, exclusion and exception, and the denominators, performance, percent variance, how many gaps to close to meet the benchmark, gaps closed manually, excuse me, gaps closed by claim versus gaps closed manually. Okay, so I know this was a lot of information already to jump into. Are there any questions of what we've gone over so far? Okay, so if a gap is closed manually, would it update once the claim comes through? Yeah, so if a claim does come through, it will be updated to show that it was also closed by a claim. That's a great question. Okay, all right.
Hey, Allie,
So,
I'm so sorry. Actually,
yeah,
just one quick thing. Would you mind
sure.
just showing people just one more time how to find the unmet number? So, like, if you're looking at the gaps to benchmark, and you want to specifically start calling people to try to make progress against that, just looking at that unmet grouping one more time.
Yeah, absolutely. So I'm just going to choose a different measure this time just so we can see some different numbers. So let's say we wanted to do some outreach for the immunization combo 2. We would just click this plus button here to get down to the member level data. And so it automatically will jump up with the not met category. So if we're wanting to focus on this, this is perfect. And so you can see all of the individuals here who have not yet met this combination 2 immunization. So you can export to Excel and use this Excel specific, not the all members, but the Excel, and it will populate all of these individuals who have not yet met the combination 2 immunization measure. And you can do some outreach. You'll have their first and last name, as well as their phone number and address. Any other pieces of the question that had come with that, Dylan?
No, that's it. Thank you. And then there's just one
Great.
more question from an attendee, Mathia, on closing gaps manually and whether they should be closed once outreach has been made by the care coordinator.
Okay, great. Yeah. So if you're doing outreach, so really, for example, if you wanted to update and close a measure that an individual's blood pressure, for example, was now under control. If we're looking at this controlling high blood pressure, you'd want to make sure that it is based on a most recent reading and that you know that they actually are meeting that, that measure now. If there's a claim, let's say, that comes later that is showing the individual's blood pressure is no longer under control, it's going to automatically reopen that measure. So if you're just doing outreach to call the individual, we wouldn't want to close those measures. We really just would want to manually close those measures when you know that these goals have been met. So let me show you, for example, what it would look like if you were going to close a member's gaps in care. I'm going to choose the controlling high blood pressure. Oops, chose the wrong one. All right, so let's say we wanted to, we had this member with the last name 123. We would be clicking on their member ID, and we could go actually to another pop-up. This is going to be a Care Coordinator Pro, or CC Pro pop-up. Again, have those pop-ups enabled. And it's going to take you to their specific portion of the CC Pro. And we can see that they are not compliant with this controlling high blood pressure measure. So if they've come in and we know that their blood pressure is actually now showing as controlled, we could click this hamburger icon and we can manually close it after entering several pieces of information. So first we want to put the date performed on, the source. So is this based on EMR? Is this based on paper chart, the wellness screening itself? Make sure what the source is, who this was performed by. You can enter a procedure description, and then you need to update the result status. So if they're non-compliant and you're saying they now are, you'd want to select compliant. You can attach any documentation you'd like to this manual entry. And the last and final part is, well, you can add some notes here too. Last and final part is making sure that you're clicking this field to sign that you are validating and attesting that this information is accurate. And then we would click on the floppy disk icon to save. And we can see that now it's gone from non-compliant to compliant. So when we went back and refreshed the view in the 3D analytics over here, the individual would then go from being in the not met to the met. Okay.
Awesome. So, Allie, we've gotten a good number of questions here on the spot. So I'll start off with this one from Kayla. She asks, or Kayla asks, is there a feature that explains whether a claim has come through or was manually entered, but that that the service doesn't essentially meet the requirements for the organization's overall performance against the quality measure? Like, for example, if a vaccine was provided and the claim came through, but it wasn't administered in the time frame required.
So for the vaccines specifically, those can only be closed by claim, or it will be closed by tennis registry update. We don't allow for any manual entry to close those specific measures. No way to add that you had given the vaccine at the clinic itself. So once you would see that in the, let's see if we go down here to the combination 2, you would see whether it was a professional source or not. And then like we had seen yesterday in the member section, when we go to the vaccine little block that's in the medical care, it would show whether it was closed by claim or if it was closed by the tennis registry.
And then, Allie, kind of building in line with that, you've described in some other sessions this week a little bit about just how an organization gets credit. So if there's kind of keeping in line with this, if maybe something, even if a claim comes through that would close the gap, but if it doesn't meet timeline requirements, how does that work out kind of between the MCO, the CCT, the gap in care, and what the healthcare providers might need to consider?
So if it's closed after the specific timeline looking at the measure, then it wouldn't count towards the measure. So like, let's say they got it the next year after they were supposed to get it, then it wouldn't count towards performance, but it would show as closed. Is that answering the question towards the vaccine? Does that help?
I think so, Kayla. Certainly, if you're out there and you can hear us, if we're kind of dancing around it but not touching on it exactly, by all means, let us know. And then there was another question about vaccines, but I think we just answered that one from Mathia. So thank you, Mathia. And then let's see, there was one question from Lisa. Lisa asks, what if the gap is closed, but it wasn't done in your office, maybe even out of state, and there is not a claim or medical record, there's not a claim, but there is maybe a medical record that you could use to manually close the gap. So, Lisa, if I'm understanding your question, Allie, maybe you can sort of describe this in line with this conversation as well. Like, okay, number one, perhaps, what happens if just the service was provided at another location and or potentially out of state? And we'll just answer that one, and then I think we've got sort of a part two to that question.
Okay, sure. So if we're talking in regards to immunization, so if it's showing in the tennis registry, that is going to show as closed. If this was not vaccine related, let's say if they actually saw a provider in, I don't know, New Mexico, where they were for like a month and they had their blood pressure controlled, and then they come back and they're saying it's controlled now. Well, unfortunately, we don't have access to those claims, so that would not close this measure. It would still be showing as open, especially if their blood pressure is no longer controlled. So if you feel like a measure should be closed for an individual because of something that happened out of state that we don't have claims for or is not in the tennis registry, that would need to be discussing with the MCO, because again, the CCT is not the source of truth. So if you close it manually because you saw that it was in the medical record that was transferred with their care, that would not formally close it at the MCO level for organization performance.
And then, so actually, I think that covered actually both kind of parts of it, Lisa. So maybe again, if that didn't answer your question, just feel free to let us know. Allie, Linda asks, do case managers add information into the tool, and if so, what information is that? And so maybe you could talk a little bit about, obviously you've walked through a little bit about how to close the gap, and if there is some sort of documentation associated with a service that you can load that into the tool. So maybe you can also address that question by talking a little bit about the value or the benefit of doing this, and how, and maybe when some organizations might find it helpful, in sort of the interim while they wait for claims to come through.
Yeah, so the benefit of closing them manually, if you know that they are now closed, is that it can help with care coordination. So keeping everyone in your organization that may be helping with this individual, or let's say, for example, they're a member in the PCMH and the THL side, it can help with both teams understanding where the member is in their care plan, basically. So it can be helpful for that care coordination purpose. If you're not comfortable manually closing them and you only want to wait for the claims, you're certainly able to do so. We just want to make this an option because we did hear from a lot of individuals that it would be helpful to be able to manually close them and attest that the information was accurate to make sure there was the most updated care information.
Awesome. And then let's just say, going back to that sort of out of state question, we got a little bit of a clarification here. So like the use case here might be a new patient comes in, they've recently moved to Tennessee, but they maybe had their well child visit, at out of state. How would one of the PCMH or THL organizations go about getting that gap closed, with regard to their MCO performance records, and then potentially starting there, because that's where everything is tracked, but then potentially coming down into the CCT.
Right. So let's say you know that they've had their well child visit for that age group, and you've seen the EMR records that were transferred over with the individuals. You can come over here to the specific visit. So we'll do the AWC 3 through 11. You can look up the member by their member ID or last name or first name. For this purposes, I'm just going to choose this first. So let's choose the second individual since there are 3. And then we would go in, it would take us over to the CC Pro. And you can manually enter that this is actually compliant. We click on that hamburger, and so it gives that option to put provider EMR. So if you've seen that EMR record that was sent over electronically or maybe printed and sent over to you another way, you'd be able to do that. You can put, maybe they had the visit in September. You can put that date. You'd put performed by, you'd go ahead and put that provider's information here, whatever the description is. You'd mark it as compliant. You can attach a copy of the report indicating that it had been closed. Sorry, I didn't mean to do that. And then any other notes that you may have, maybe completed out of state before moving to Tennessee. You'd click the signing the form, you're attesting that this is true and accurate, and click the floppy disk and save. And it'll go from showing non-compliant to compliant, show when this was performed on and next goal date. And it would update once you refresh it over here, so the individual will now be in the MET. Now for MCO performance-wise, you know, you'd have to talk with the MCO to get that updated, but most likely since this happened before they came to your care, it would probably not count for your credit. But if you're, you know, wanting to show that, yes, well, these individuals have actually met the measures, these measures are closed, it should be counted towards the close, you definitely need to talk with your MCO since there won't be a claim submitted from your organization to close that measure. And just, yeah, following up on that question, does manually closing the gap completely close it? It closes it here in the CCT for care coordination purposes, but to be closed for counting towards your performance at the MCO level, it does need to have a claim follow.
And so maybe just one more time, Allie. So I guess just to the straight heart of it, do you have to close the gap manually?
You do not have to close the gaps manually. This is just for your benefit if it will help with your organization's coordination of care for members. And if you do not feel comfortable doing that, you do not have to. This is just to make sure you have a place to have the most updated information while you're trying to coordinate care for each of your members.
Well, thank you, Allie. I think that gets us through our list from that section. So thank you.
Great. All right. Thanks, Dylan. Okay, so I'm going to go ahead and close out of this and I head back to our dashboard. So we had got to the quality measures report through clicking this widget. There is a second way that we can get to reports, and that is coming over here to the left-hand menu, and we will click on reports. Again, going to bring up a pop-up, a 3D analytics. So again, just going to hammer away. You need to make sure your pop-ups are enabled. All right, so this is just a quick overview of what the 3D reports look like. You have several different reports to look at. We think up here as a funnel. We start off with the widest part of the funnel being the practice, and then we kind of come down to the middle levels, and we can look at reports at the provider level. Coming down even further in the funnel, for those practice administrators, you are able to delve into reports at the care manager level. So if you're looking at, you know, performance and outreach numbers, you can come here. For this purpose, we are going to focus on practice, and we're going to go down here to quality measures at the practice level. So again, we'll see we have the options to select several different items that we had seen on the last page. So again, line of business is always going to be Medicaid. The coverage type is going to populate with whether you're a PCMH or THL. You have the option of choosing one or all of the MCOs you're contracted with. It'll always populate with your specific practice. And then again, you have the ability to search quality measures by your practice type. And just since we're in the training environment, I am going to choose all. And then you have the option to choose a time period. So for this purpose, I'm going to stick to 2020. Then we would click View Report. And it's going to bring up those same view of the measures and performance that we had just seen on the last screen. So again, this is just a second way we can get to this report. You can do the same features of drilling down to the member level by clicking the plus icon. You have the ability to collapse all the rows or expand all the rows, and then to export. You also have the ability with this section to view it in a couple different ways. So we have the profile summary, which gives it in a bit different format. So we can see all of the headers up here for each of the measures. We have our practice name here. We do have this little plus icon, so we're going to go ahead and hit that. And it's going to show all of our members. And it'll show how many measures they are not compliant for, how many they are compliant for, any chronic conditions, as well as how many admissions, readmissions, and discharges they've had. So again, it's just giving just a overview, how many members you have that are compliant or not compliant with measures, and just a different view of how you'll see all of these different measures up here. We can see at the very end over here, we have total non-compliant members and total non-compliant measures, which could be helpful. This can also be exported to Excel, CSV, PDF, or rich text format. Right. We also have the monthly trend. And this is going to show your practice's performance over each month for the year by each measure. And you can again export this to either Excel, CSV, PDF, or rich text format. And I do see a question if we can separate this by provider to show each provider their rating is. Yes, we absolutely can. So that is the next drill down I will go to. All right. So yeah, I'm just going to jump right in. So we're going to go further down into the funnel. We're going to choose provider, and this is going to give us the performance information at our provider level. So here you see we actually have a change in the filter features for the report. So for our organization, we have the ability to choose a specific or multiple providers at our organization. And again, you can choose one or all of the MCOs that you are contracted with, and then the time period. You just choose a couple and view report. All right, so it'll populate all of the measures similar to what we'd seen on the last couple of pages, where we have all measures by domain. For the training purposes, we do not have any individuals meeting the provider name because it's all been de-identified. So that is why we are seeing the NA here. So it's not applicable because we don't have any members for these providers eligible for any of these measures. If you did, you'd be able to see the same things that you had seen on the previous screen including their performance towards meeting the benchmark and the percent variance. And you'd be able to export this information to Excel if you wanted to do some more data manipulation as well. We also have the profile summary. Again, if this is more of the preference of kind of what you're looking for, to have the ability to drill down by each of these measures and have all of the individuals listed who are compliant or non-compliant, how many they're compliant with, non-compliant with, etc. Let me just see if we can get any coming up with another name. So here you can see we have 100 here for that CDC A1C, 38 for the well child visits 3 to 11. And we can click this plus icon just to get a bit more detail. And it's going to list the member ID, member name, and that non-compliant measure. Show you what it looks like in the Excel. All right, so here's where you can get that breakdown. Again, it's going to list all of that information, all the members attributed to this provider, and how many non-compliant measures they have. Okay, there's a lot of questions coming in now, so this is good. Is the choose combine? So it's actually right now only letting me choose just one provider to look at a time rather than multiple providers. And then can you close multiple gaps at one time? Okay, perfect. Thanks for answering that, Dylan. Appreciate that. All right. Any other questions on what we've, oh, sorry, go ahead.
I'm sorry. I was just going to say those are all the questions that I've been tracking over the past few minutes.
Perfect. Nice. Okay, so I did let our MCO partners know that I wanted to show them what it would look like once they log in, since they will see slightly different and have slightly different reports. So I am going to log out and log back in as an MCO test admin. So when MCO admins log in, they're going to have a bit of a different landing page. So they have the ability to go to Care Connect Pro, and this feature for MCO admins focuses on ADT, so we will go over this tomorrow. The other is 3D Analytics, which is where we were just doing the reports and quality measures. So I am going to click 3D Analytics. And you can see this looks very similar to what the care coordinators and the practice administrators were seeing. You just have one hire on the filter, which is at the organizational level, since you have the ability to manage multiple practices at the same time. And you are not able to drill down to provider performance per practice. For this purpose, again, we're going to look at those quality measures so you can see we have similar filters for the reports. If you're blue, you will only be able to see your blue member panel. So it's not like you'll be able to even have the choice to choose Amerigroup or United. And then you can choose practice type. Let's just say we want to look at all practices and the time period of 2020. So we'll view report. You can see at an overview of how all of the practices are doing as a whole. Most likely, you're probably going to want to go to the practice level, though, to drill down to the practice, a specific practice level. So here you'll have in the reporting filters the addition of practice, and you can choose multiple practices. You can focus on one practice. For this, we'll just focus on one. You do also have the ability to choose, let's say you chose all of your pediatric practices, you could select the practice type as just the pediatric to pull up those pediatric quality measures. And again, you can look at time period. I'll go ahead and view report. And we can see for this test environment that this practice has what their performance is for each of the goals related to their practice type, which happens to be pediatric. And we can see again those met, not met, exclusions and exceptions, the denominators, practices performance towards the benchmark and the variance, gaps to meet the benchmark, etc. So you also have that ability to export to Excel with just the face sheet of what we're kind of looking at, or you can export all members, which would show every single member for this practice and their performance towards each of these measures. So very similar. You'd also have the ability to view this in profile summary if you kind of prefer to look at it from this view. And you can export from here again. You can also look at it from that monthly trend. Right, so any questions on this view from the MCO side? And I did have a question come up in our last session that may be helpful here. Just a reminder, if you're looking for the enrollment for a practice, it is also here in that 3D analytics up here. So if you wanted to compare your quality measures and your enrollment over time, for example, you'd be able to do that. Again, coming to the enrollment page is automatically going to give you enrollment by plan for each month over the year so far. And yes, we have a good question come in. You will only see the measures that your practice is responsible for. So if you're a pediatric serving a pediatric population, you will only see those pediatric measures. Yes, no problem. All right, any other questions? Okay. All right. So just as a reminder, you can get to quality measure reports in multiple ways. I'll go back and show again, just as a quick overview. So from the care coordinator or practice administrator's perspective, you can get to the quality measure reports by clicking on the quality measure widget from the care dashboard. So right up here. And we can also get to it from the reports section, which would take you to the 3D analytics. And from there, then you'd have that pop up and you'd be able to look at quality measures at the practice level or drill down to the provider level. And either way, you'll be able to export the data for further manipulation. All right. If there's no other questions, what we're going to do now, bring up that, we're going to bring up our end of the day poll to get a reading on how effective this session was. We really appreciate all of your feedback. It helps us improve for our next sessions. I will be taking questions in the chat. If things come up as you're taking the poll that you think of, happy to answer those for everyone. But we do request that you do complete the poll because, again, we really take that information to heart. Once you're done with the poll, and if you don't have any other questions, you're free to leave for the afternoon, and we will see you back here tomorrow. So thank you again for joining us. Thank you for completing the poll, and we appreciate your attending these sessions.